Good morning to everyone who makes possible this broadcast, to Abdiel, to the sign language interpreter, to the staff of Radio Havana, Cuba, who translates the conference into English, and the audience tuned in to this briefing. Today, we report 5,883 hospitalized patients, 581 are suspected cases, 3,512 under medical supervision, and 480 are confirmed active cases. Yesterday, 5,770 samples were processed at the molecular biology laboratories of our country, 1,575 at the Tropical Medicine Institute Pedro Coury, 579 in Villa Clara's Hygiene, Epidemiology and Microbiology Center, 456 in Havana's, and 275 in Santiago de Cuba's. 532 samples were processed in the Genetic Engineering and Biotechnology Lab, 414 in the Center for Molecular Immunology, 365 in Manuel Fajardo Hospital, 358 in the Naval Hospital, 316 in Fructuoso Rodriguez Hospital, 307 in ICA Laboratories, 272 in the National Civil Defense Labs, 206 in Hermanos Amejeiras Hospital, 115 in Ciego de Ávila's laboratories. As a result of the analysis and processing of these 5,770 samples, 38 people tested positive for COVID-19. This brings the total number of samples processed since the pandemic began to 656,805, of which 5,883, or the 0.9% of people, have been diagnosed with the virus. Samples from all of the country's provinces were tested. Pinar del Rio processed 103, Artemisa 113, Havana 3,197, Mayabeque 252, Matanzas 188, Cienfuegos 137, Villa Clara 96, Santi Spiritus 418, Ciego de Ávila 827, Camagüey 159, Santiago de Cuba 143, and so forth from every Cuban territory. The 38 people diagnosed yesterday are Cubans. They are not imported cases. 37, or the 97.4%, are confirmed case contacts. They were all being monitored in isolation units, as indicates the protocol followed by our health professionals. The 91.8% of all diagnosed cases in Cuba have had contact with someone who had previously tested positive to the virus. Therefore, this represents the most important risk group. The source of infection linked to one patient is yet to be determined. Hence, the figure stands at 33 patients whose source of infection is being investigated. As I mentioned, none of the patients contracted the disease abroad, what accounts for 446 imported cases. 20 patients are male and 18 are female, for a 51.1% and 48.9% respectively. 30 of the 38 patients, that is a 78.9%, were asymptomatic at the moment of the test. This figure therefore means that a 61% of all confirmed cases in Cuba up to date did not present any symptoms while being tested, that is 70.8% over the last 15 days. 5 individuals are under the age of 20, of which 4 belong to pediatric ages. What stands at 652 diagnosed patients under the age of 18, the 88.8%, or 579, are discharged and recovered from the virus. 20 patients are between 20 and 39 years of age, 12 between 40 and 59, and 1 patient belongs to the 60 or more years of age group. Of the 38 diagnosed cases, 26 are from Ciego de Ávila, 7 from Santi Spiritus, and 5 from Havana. In Havana, the 5 cases belong 3 to Centro Habana, and 2 are from Boyeros. In Ciego de Ávila, the 26 patients belong to the municipality of the same name. In Santi Spiritus, 4 patients belong to Santi Spiritus, 2 are from Trinidad, and 1 from the municipality of Yaguajay. Therefore, Ciego de Ávila's confirmed rate per 100,000 inhabitants over the last 15 days continues to be the highest in the country, with 61.32, followed by Santi Spiritus, higher than the day before, with 27.9. Havana's rate decreases to 13.11, as well as Matanzas with 5.7, Mayabeque with 2.08, Artemisa with 0.97, and Camagüey with 0.13. Villa Clara and Holguín remain with similar rates as the day before, with 0.26 and 0.1 respectively. Nonetheless, the provinces of Cienfuegos, Pinar del Río, Las Tunas, Granma, Santiago de Cuba, Guantánamo, and the Isle of Youth Special Municipality remained free of COVID-19 cases over the last 15 days, and in some territories even for 1 or 2 months. Therefore, Cuba presents a rate of 6.57 per 100,000 inhabitants, slightly lower than the day before. With this analysis of the 5,883 diagnosed patients in Cuba up to date, 480 are hospitalized active cases, that is the 8.1%, of which 478, or the 99.6%, are clinically stable. We did not report any deceased patients today, hence the figure of COVID-19 fatalities stands at 123, for a mortality rate of 2.09%, lower than the global rate of 2.94% and the regional rate of 3.32%. I always mention the 2 patients evacuated at the start of the pandemic. Yesterday, 46 patients were discharged from hospital, a positive indicator concerning discharged diagnosed cases ratio. The 46 discharged patients belong 23 to Havana, 6 to Mayabeque, 3 to Santi Spiritus, and 14 to Ciego de Ávila. Thus, it accounts for 5,278 patients, that is the 89.7% of all diagnosed cases in Cuba recovered from the virus. 1 patient is reported as critical, admitted to Villa Clara's hospital. 1 person is in serious conditions, hospitalized in Havana. Concerning worldwide statistics, COVID-19 pandemic remains to be present in 185 countries. 260,638 people were diagnosed with the disease yesterday, for a total amount of 35,247,140 diagnosed cases. 3,829 fatalities were reported yesterday, what brings the global death toll to 1,038,069 and the mortality rate to 2.94%. The United States continues to top the list of the worst affected countries by the pandemic, with 7,417,845 COVID-19 cases and 209,794 fatalities, followed by India with 6,623,815 cases and 102,685 fatalities. Brazil with 4,915,289 diagnosed cases and 146,352 deaths for COVID-19, and Russia with 1,215,001 cases and 21,358 fatalities. The region of the Americas stands at a 48.89% of all cases worldwide, with 75,399 new cases diagnosed yesterday, what accounts for 17,232,622 infections. 1,670 deaths were reported in the region yesterday, what brings the regional death toll to 573,439 and the mortality rate to 3.32%. Turning the attention to the most affected countries in the region, right after the United States and Brazil, and taking into account the number of diagnosed cases, comes Colombia, Peru, Argentina, Mexico, Chile, Canada, Ecuador, Bolivia, Panama, Dominican Republic, Guatemala, Honduras, and Costa Rica. As you can notice, Costa Rica joins the list with 79,182 cases and 950 deceased. Mexico continues to report the highest mortality rate in the region with 10.38%, and Ecuador comes next with 8.26%, followed by Bolivia with 5.92% and Canada with 5.71%. Thus, Cuba is placed in the 21st position in the Americas with 5,883 diagnosed cases up to date. This is all the information on the behavior of the pandemic in Cuba and the world.